And today we'll be speaking about chronic kidney disease and science behind it. Today, primarily, we'll discuss the main causes of kidney disease, as well as symptoms and treatment. Shahid Muhammad will be our speaker for today. Great to have you on today's podcast. How are you doing today?
Yeah, good. Thank you for this invitation. I'm feeling quite enthusiastic to help, the audience, patients and carers get a bit more clarity around chronic kidney disease. As we're in two parts of the world, I'm based here in England, UK, and it's still quite warm. It's a warm evening, so it's good to be inside, talking.
Excellent. Yes, it's really nice to be able to connect. Here we are in California on one side, and here we are in UK on another side. Absolutely. And we can join the conversation about the CKD since we have many patients who listen in this podcast on both sides of the world. Again, great to have you, Shahid, on this conversation, reviewing the chronic kidney disease and reviewing on one side what are the common groups that get impacted by chronic kidney disease, what are predecessors like diseases, conditions, lifestyle may be causing kidney disease, sure. Especially chronic kidney disease.
Yes, okay. Yes, so thank you. If we, before I embark on that, providing an answer for that, it's important to know there are other things that can cause, kidney disease. There's your renal function in itself, or kidney function in itself. Its main function, obviously, apart from filtering waste and waste and byproducts, toxic waste and byproducts from the body. It's also important to understand that the kidneys, they're important in long-term regulation of blood pressure. So it's important that that's understood by the audience, because this also relates to the importance of trying to, I guess, keep fit and healthy as best as possible, because if by reducing the amount of pressure that your kidneys might have to deal with, your kidneys have the ability to have more blood flow through the kidneys, and that actually opens, it allows the blood vessels to open and so forth. So basically by having these things understood, this means there's ways to alleviate that sort of pressure. Now, if we look to your question about what groups are affected, for example, kidney disease can affect all ages. In essence, it affects all ages, all groups. There's no discrimination, and let's be quite clear here. As I've mentioned, I have an interest in pediatric nephrology and adult nephrology. So automatically, we're saying that it affects those groups of people. It can happen to the very young. It can happen to the elderly and the very old, but it also can happen quite commonly to those in middle age, in the middle age group as well. So however, there is evidence to show that individuals or groups of patients who have type 2 diabetes in the adult population are more at risk. This is because blood vessels leading to and from the kidneys are vulnerable to becoming damaged owing to the effects of high blood glucose and also cholesterol over time. High cholesterol is not good for you at all anyway, but these things in terms of laboratory parameters, I guess you could say, these are things that need to be monitored closely to prevent either acute kidney injury or chronic kidney disease.
Excellent. Thank you so much for explanation. And I think it's just great to hear this aspects of, the common diseases as well as the common root causes of kidney disease on a scientific way, understanding that the blood pressure, high glucose, poorly managed diet, and high cholesterol can cause kidney damage. And it's, I think, something that's a phenomenon which is quite negative in the United States. It's a late or delayed diagnosis of kidney disease. And in our audience, we see a lot of patients, renal patients, who have been diagnosed in stage 4, in stage 5, when they already have been showing the very significant symptoms and some other symptoms they had before, or certain health conditions they haven't had the knowledge, understanding this might be a high risk of kidney disease.
Sure.
So, statistically, there are more than 30 million of people in the United States impacted by kidney disease. And almost 90% of them are not aware that they have the condition. And I'm sure the numbers in UK might be similar or might be a bit better. However, what do you think, as a scientist who understand that kidney disease is a really hidden disease until it's in a certain stage that it's showing symptoms?
Yeah.
However,
so
why do you think the reason are the disease has been diagnosed in such a late stage, and any ways that we might improve the diagnosing of kidney of renal patients?
Okay. So in part of the explanation, I guess I've alluded to, in a previous question, was that kidney disease, by all grades, really, it's a silent disease. It's termed as a silent disease, and you could almost say, if it was going to harm any individual, ultimately it's also, I'd go as far as saying it's almost like a silent killer as well, because, the disease itself, it's kind of almost, you have all these little things such as high glucose, potentially high blood pressure, potentially, or high, cholesterol, or, all of these things, they add up. And then it's only then when those things are, causing detriment to health, that then, kidney disease becomes apparent. So I think, when we're talking about, the kind of, the disease in its entirety, it's still known, at least here in the UK, and perhaps actually in the US, is still known as a silent disease. And because it's a silent disease, it's not probably treated or understood at population level, because when we're looking at anything at population level, that's when health becomes more serious, because we start looking at the statistics a bit more intricately, a bit more detailed. So those comorbidities I've mentioned, for example, those are your main disease states that patients or individuals face. And then kidney disease, if it happens, whether it's acute kidney injury or it's chronic kidney disease, then this happens. These types of diseases happen a bit later. They don't happen, all, and because they don't happen, at population level, or not known at population level, per se, then this means that, I guess the education is not really focused around these diseases, as they are around, diabetes or hypertension and, other, disease states. So this is probably why it's still known. Not only is it a silent disease, but I'd say it go as far as to say it's a sort of a hidden disease, in terms of where education is concerned as well. So, and that's quite, it's an interesting phenomena because it's very detrimental. Once patients or individuals have kidney disease, as you're probably aware and your audience is aware, it's irreversible. So, it's, once they have it for life, so really I think what should probably happen more perhaps in the US and in the UK is the way education is delivered around this disease needs to be shifted. That means perhaps not, those who deliver education at primary care level, within, part of the primary care, or primary healthcare team, they should become perhaps more aware about this disease, and also where I guess scientists could get more involved or actioned around this is perhaps providing a bit more understanding around the disease tests that happen for patients behind the scenes. So I mean, if we were going to talk a little bit, I'd like to give the example, if you don't mind, around polypharmacy as well, for example. So you can get patients who might be diagnosed with diabetes or again hypertension, and these comorbidities, which eventually might lead to chronic kidney disease. As part of those disease packages, patients might be prescribed a number of medicines, to help to control those particular diseases. So what inevitably happens is that they could be prescribed medications that, for example, control obviously things like blood pressure, high blood pressure or high glucose, for their diabetes, for example. But the drugs themselves can be quite detrimental. They have their own side effects. So for example, you can have patients who might be on more than one or two antihypertensives, for example, and these particular drugs could cause problems, to renal function over time or kidney function over time. So this means, they can cause renal insufficiency, and that means there's a reduced, the reduced function, the functional components of the kidneys, for example, the nephrons, these reduce in number over time. Just to mention to your audience, the kidneys, they have nephrons, which are your filtering units of the kidneys, and they actually help to filter all the toxins and wastes, from the blood, through urine, on a daily basis. But if they reduce, in number over time, this is another thing that causes renal insufficiency, and medication, or being on a number of medication, can cause, that problem, because the medication can, cause what we call nephrotoxicity. So this is something that I think the audience could benefit to know. I think it's always wise to speak to a pharmacist or a primary healthcare physician, or even a nurse, who has, good grounded knowledge maybe around, some of these things. But equally, I think there's scientists, could be more, I think, on the forefront to provide this understanding.
Excellent. Thank you so much for explaining this part. And, to summarize, on one side, the common causes of kidneys could be the comorbidities the person already facing. On another side, it could be the medication. And what you really mentioned of potential ways of improving prevention and early diagnosis, how can the patient be more aware to do the certain tests, blood tests to get diagnosed, as well as how the primary care could be more proactive, knowing that the given condition or given medication that patient have to take can lead to kidney disease. On one side, we believe that patient could be more proactive on their side, receiving education and receiving knowledge what they have to request for their primary care and demand doing certain tests if they have a high blood pressure, if they have diabetes, or they're taking quite complex medication. At least they can ask proper questions. Could it potentially damage my kidney? How bad? And is there any test I could take after or prior to define whether my kidneys can tolerate this medication? So what would be your advice in this case?
I think, you know, I mean, my specialist background is, you know, obviously around chronic kidney disease, but from the laboratory perspective, it has been, you know, in biochemistry and elements of hematology as well. And, you know, although, you know, at the moment, you know, there's very, you know, when patients or individual, for example, try to approach, you know, getting information about their disease or conditions or even symptoms. For example, if they try to, you know, Google a certain term, for example, if you put in, I don't know, cancer, you know, or the type of cancer into Google, you have, you know, a lot of information potentially around that condition. And the same can be said for, you know, acute kidney injury and chronic kidney disease. So initially, I think one of the approaches has to be, or should be, is that patients should speak to, you know, their team, whether it's in primary care or secondary care, and then basically find out, you know, exactly what terminology that team is referring to, because by doing that, you use those exact terms when you look for your own information. But at the same time, you have to do this in such a way that, you know, communication in any shape, way, or form has to be two-way anyway. It has to be a dialogue. So, you know, if someone was to hear, for example, oh, they've got chronic kidney disease, instantly they may think, oh, it's a terminal illness, I can't do anything about it, you know, or you know, I'm going to die in 2 days' time or something like that. So it is scary if, you know, if the information or understanding is perceived in that way. So firstly, it's about understanding what terminology and whether that's layman terminology or medical terminology, whatever it might be, you have to get that understanding from, you know, the clinical team or medical team first. That's you know, primitive, and is very important. And then the patient really has to engage with, you know, that understanding, not be fazed by it or scared by it. And so basically look for these, you know, understanding you can use online means, but go to validated websites. For example, in the UK, for example, there's website called Think Kidneys. You know, they're very good. They have, you know, quite a lot of information around all aspects relating to chronic kidney disease. And there's, you know, I think there's My WebMD, which is very, very, I guess it's very broad. It does have some, you know, a lot of medical related terminology, but then at the same time, I think patients and the public generally are being prompted to self-care more anyway. So it's about interacting with that information in a kind of informative manner, really being, you know, self-aware and really self-determined to actually do something about, learning about the condition and not be fazed by it, because by interacting with it, you're then becoming empowered, to know more, and that way you take control. So from a scientist's perspective, I mean, if there were for example, if there were scientists, involved in delivering this kind of understanding or education, at least, then I think, scientists would probably want that, for the patients as well. They would want, the patients, to receive that understanding or education, so that they do become more empowered, and, that they are not going to, be faced by, the difficult so-called terminology that might surround the disease. And clinical teams, I think they do their very utmost, to provide that understanding. But whether it's in primary care or secondary care, the issue is time constraints. So, if patients can do more, just to use some of the basic information, for example, that might be provided, and then take it upon themselves to find more out, then bring that information, to their next appointment, for example, that can actually, bring on, more discussion and more prompts to actually, see what could, what should be part of, that patient's care plan. But education, as you're probably aware, and your audience is aware, it's an ongoing thing. It's not final, as soon as you are, if you're labeled, for example, with chronic kidney disease or acute kidney injury, it's not a final thing in terms of, sort of, oh, I have this and I can't do anything about it. It's not about that. You have to be able to sort of accept what you have, and grasp it, but then use that information that you get or understanding to, better yourself and empower yourself. So I think that's important. And I think one stage further is, I mean, from a science perspective or scientific perspective, I think it'd be fantastic, to be able to provide understanding of what sort of tests, are important, for, such patients behind the scenes, because often, we do these tests, or tests are done, and we, obviously provide that information to the clinical team to inform, the patient's care plan. But, it's, I think, when, for example, you can have patients with a high potassium, for example, but what does high potassium really mean? Some patients would say, or probably even some clinicians might think, that, it's going to cause, immediate problems to the heart, for example, because, potassium is needed for, cardiac function. But, it's not massively a problem if, for example, your potassium is high only by a little bit, it's not going to cause, massive problems straight away, for example. So, so I think, it's important to know what those, not just what the laboratory parameters are that are important in, part of the whole stage of kidney disease, but also, to understand, what do those laboratory parameters actually mean, and what are their, what are their test ranges? That's very important, I think. I think we're still a little bit away from that, where, delivering understanding and education is concerned, because, there's already a lot of information out there, and, patients, can be overwhelmed with information as well. And that can be a problem. So it's taking steps at a time, I think.
Yeah, I really appreciate the very open answer you've given, specifically on this way, how patient and medical team could build a better communication, and how the self-education, as well as, again, conversation and interaction with medical team, can build a better awareness for patient, asking better questions, being more curious about reading the diagnosis or reading their blood test and finding out what they can do about it. So ultimately, that is a teamwork, and patients not alone in it. And to be able to help your team, patient have to play an active role in their disease management. So another question I have, we've seen it very often, as we discussed earlier, when a kidney disease considered to be a silent disease, usually a first person who impacted in a family by kidney disease, they share a lot of awareness. And we have a broad amount of audience who have maybe their grandparents or their parents have a kidney disease, a renal disease. And some of them might be already on dialysis, some other in some other stages or conditions, but that really shares a lot of awareness that kidney disease might impact them sooner or later. So what would you suggest as a scientist? Is it really inherited? How patients who have a family history with kidney disease also can think about prevention or early diagnosis, or looking for some of the symptoms, there might be those early signs of kidney disease in their life and health.
Yeah, sure. I think you've touched on a very important point. So in the beginning, we talked a little bit about the fact that, there's different definitions and terminologies, acute kidney injury or acute renal failure, or acute renal failure, or chronic kidney disease, or, in some parts of the world, it's end stage renal disease. All of these terminologies, come to mind. But the important thing here is to know that the disease itself can affect anyone at any age. So a question around about can problems related to kidneys, can they be inherited? Well, yes, there are some or a few forms of inherited kidney diseases. So some kidney diseases, for example, polycystic kidney disease. That's it's a known genetic disorder in which cysts can form around the kidneys, and these cysts, they can grow, and what that means is they collect basic poison and toxin that the kidneys would normally filter through the blood and excrete through urine, and you void through urine, but the cysts will collect all of this, and these can slowly replace the kidneys themselves, actually, and then obviously that further reduces kidney function, and leading to chronic kidney disease, really. And so that's one form, polycystic kidney disease. It can be it usually it's familial, in the sense that a mother might have kidney disease, for example, and it's passed. Polycystic kidney disease itself is passed on, to the child later on, or it's passed on hereditary, and then what happens? The child actually won't have any symptoms, or won't feel that they have any symptoms, until probably late teens or early 20s, and that's when this disease can cause detriment to that young person. but also the signs of you know, this kind of kidney disease or polycystic kidney disease, you know, can vary. You know, in the child, the symptoms vary. They may have, again, they may have back or side pain, you know, and again, the pain, you know, can be on and off. You know, it can be quite dull at one moment, or it can be really painful and sharp in another moment. So it might be that one of the preventative strategies to help this is, you know, is obviously looking for renal insufficiency in the first place, looking for, you know, problems with renal function. And it might be to confirm aspects of, for example, you know, polycystic kidney disease, that that patient has to be referred for a biopsy. Biopsy would entail, you know, a small piece of tissue being taken from the kidneys to actually determine that they have, you know, renal problems. And the laboratory team behind the scenes will help, you know, detect, you know, if that's the case. So, you know, so polycystic kidney disease is probably one of the most, you know, important inherited kidney diseases to be aware of, I think. And I think also, you know, Iga nephropathy or nephropathy is another, you know, form of, you know, kidney disease to be aware of. Obviously, there's various stages of this particular disease, but primarily the important thing to know about this is the amount of protein leaking that might occur, you know, at any one time. You know, through the urine. So if you're leaking, you know, more than a certain amount of, you know, a specific amount of protein through urine, then it means that, you know, you could potentially have, you know, IgA nephropathy, and actually it's quite a common cause in some parts of the world to have this. So I think, you know, looking at getting testing for protein leaking, or what we call here, I think you probably call it in the US the same thing, albumin creatinine ratio. This is an important test to try and have done. If that ACR or albumin creatinine ratio is high, then you know that the kidneys are leaking more protein than they should be, and that can be quite detriment, you know. But there's also, you know, symptoms, I think, where we were talking about your you know, your audience. For example, if you have someone in the older generation who might be on, you know, a form of, you know, renal replacement therapy, i.e. on hemodialysis, for example, you know, what if they were in, if they're in that condition, you know, and they wanted to pass on knowledge or understanding to someone in there who is younger, who might be in their family, for example, then I think it's important to, you know, have checkups for, you know, things like urinary tract infections, you know, potentially looking for, you know, signs of, you know, frequent urinary tract infections, looking to understand whether they, you know, if they feel tired or fatigued, why is that the case? You know, look and get an understanding around that. You know, do they have blood pressure problems? Do they have hypertension? You know, and if they, again, coming back to the tiredness or fatigue side of things, you know, it's important to understand what the hemoglobin level is, because hemoglobin is important for, you know, red blood cell function. And if this is, you know, quite low, then it's a problem, you know, because it's actually what the kidney does. It's actually helps regulate erythropoietin, which is an important hormone for red blood cell stimulation. So that's important to know. Knowing what your iron levels are that's important as well. Your calcium, and I think also, even phosphate levels. I think the calcium and phosphate is probably more important, if you are actually on hemodialysis, at later stage in renal disease. And it becomes more important at that time, perhaps more so than, the earlier, acute kidney injury, stage, because it's not as, not as obvious, I would say, at that stage. And obviously, if you have a change in the pattern of, going to, void your bladder, if that pattern changes from the normal, then it's important to, get a general health check and have a look at what your renal function is doing.
Excellent. And it seems there are so many things that could be as a science of kidney disease, and just really getting the head around and understanding what something might be not working right. On one side, looking for early symptoms like tiredness, early symptoms, urinary tract infection, as well as some other symptoms related to vomiting or dizziness, sudden weight gain or weight loss. What are other common symptoms some people who haven't had yet kidney disease but might be experiencing should consider as a warning signs?
Yeah, so I think coming back to one of the former points about the urinary tract infections, I think, urinary tract infections, for example, the important thing to know here, your renal function, generally, even in the healthy population, over time, the renal function, can, or does decrease over time anyway, and that's a natural thing. But where your urinary tract infections are concerned, if this can happen, the occurrence of UTIs, they happen, can happen in early life, in young people, and in older people and middle-aged people. So the important thing also to prevent this happening in the first place, is about keeping your fluids up, because naturally the kidneys, as I'm sure your audience is well aware, at least to an extent, that the kidneys are a wet organ. They are wet organs, in their natural form. So it's actually about keeping them wet, really. So keeping your fluids up, even if you have to force yourself to drink fluids, that's the most important way that you can decrease the probability of having urinary tract infections. So urine naturally should be quite a clear color. It shouldn't have like a yellow or or a sort of bloody color. It should always be quite a clear, almost kind of sterile color. So it's important to keep drinking water. Naturally, you should be drinking probably 1.5-2 liters a day. But if you can, increase even a bit more than that, that will help, I think. So this is important to know. It's also, I think, it's important to know that if there's real fatigue, for example, and you don't have any reasons why that fatigue is occurring, that again, it's important to know, get to the underlying cause of why this might be. So if, for example, you've had a hard gym workout, or you've done, a lot of exercising, and then, for example, you feel tired or fatigued that makes sense because, you've put yourself through that, physical activity, for example. But if, for example, you haven't done, anything, exhaustive exercise, or you haven't exerted yourself, and you feel tired, then, on a normal day, and that's happening more frequently, then that's a sign that, you might have, a decrease, you might have some renal insufficiency there. But just tired alone, being tired alone isn't the only symptom. So I just want to make that clear to your audience, that tiredness alone isn't the only thing. There might be something else that's going on that, your body, or physiologically, you're not aware of. So that's why, physicians, and educational teams, they always say it's important to get a health check, and I would recommend that as well. It's understanding what's causing that tiredness. So if it is renal function, at least that is to do with your kidneys, that's why your tiredness is keeps on happening. But the tiredness could also be related to low hemoglobin and low iron levels, because having low hemoglobin means that your kidneys, for example, are not stimulating enough hormone levels, erythropoietin levels, so that there's more red cells, for red cell production. So this could be another cause of that tiredness. So it's not always one thing with kidney disease. It's always that's why it's quite a silent disease, because all the one or two of these things is not enough sometimes to make a whole picture. Sometimes it's like aligning all the stars. You need lots of things to happen before you can actually say, a patient definitely has, acute kidney injury or chronic kidney disease. But, there are ways to reduce the probability. And I think obviously education and understanding around this in the first place is most imperative, because that's how, by getting the right kind of information and insight, you then know, or your patients know what to approach, their, family physicians or, specialists, with, when it comes to communication. So, yeah, I think those things that, we've touched on, those are some of the things, that, could potentially cause, renal insufficiency, and they need to be picked up quite quickly.
So the takeaways for the patient, on one side, to observe any changes in their body, any changes in their energy level, any changes in their weight, the color of their urine, and communicate well to their medical team. So this way, the medical team would have a better knowledge how to test the patients and provide them necessary recommendations for the next step.